Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. Summer's just heating up, and the first day of school kind of sneaks up on families every year. Now, with the pandemic disrupting annual preventive health visits, childhood vaccination rates have been declining. Now, the number of children with required shots nationwide is falling below herd immunity, raising the risk for disease outbreaks as students head back to school. So, what does the medical community want parents to know about the importance of getting their kids up to date on routine vaccines? Visiting us is family physician Dr. Christopher Scuderi, joining us to talk about the importance of getting your kids up to date by adding vaccines to your back-to-school checklist. Welcome to Health Professional Radio, Dr. Scuderi. Thank you for joining us this morning.
Thank you so much for hosting me, Neil.
Why is it important for parents to follow their child's immunization schedules and basically ensure that they're up to date on their vaccines before they go back to school?
So, Neil, I think there's a couple of reasons why this is important. And the first, I have to stress to parents, there's no time better than now to make sure that your child is up to date on the recommended vaccinations. A big reason is because a number of children across the country have missed their well child visits over the past 2 years. And so I'm concerned that these children are falling behind on their immunizations and are at risk. And so I want to stress to parents who are listening today just that childhood vaccines are one of the most life-saving medical interventions in history. If you look in the past 20 years around the world, childhood vaccines have saved the lives of over 37 million children. And so I think often parents forget how important these vaccines are because they're preventative. They're doing something to protect your child in the future.
Now, the phrase herd immunity has become a big part of our daily vocabulary. Why is that important? And exactly what is herd immunity?
So herd immunity is a concept that we've heard over and over during the COVID-19 pandemic. But for those out there who may not be familiar with it or unsure about it, herd immunity occurs when the number of persons in a community become immune to specific disease, and that makes the likelihood of the disease being spread person to person unlikely. And why this concept is really important is because if that level of immunity in the community drops 1% lower than the threshold needed for herd immunity, that disease may come back. There may be a devastating outbreak of that disease. And so a great example of this in the United States is measles. In the year 2000, the United States declared that measles was eliminated. Yet in the year 2019, there was over 1,200 cases of measles in the United States in 31 different states. And so it's important each of us do our part to maintain herd immunity to stop these diseases because they're occurring in other parts of the world regularly.
Talking about a timeline, ensuring that our kids go to school fully vaccinated, what should that timeline be? And talk a bit about scheduling appointments. Is that part of that timeline?
It is. So if there's anything I could stress to parents listening today, make the appointment now. First and foremost, I'm a parent. Being a parent during the summer, it's a busy time. And so you want to make sure that you schedule the appointment while you're thinking about it because life gets busy. The second reason is that the few weeks right before school starts tend to be some of the busiest weeks at a physician's offices. So it may be difficult to get into your physician's office at that time. And so, scheduling the appointment now is definitely recommended. Another reason why this is important is some vaccines need to be given in series. So there may be a couple weeks in between a first and second vaccine. So your child may not develop peak immunity for a while after that. And so the sooner that you look to immunize your child, the better they'll be protected going back to school. And the last reason is I'm sure that there's a number of parents who are listening who may have some new questions about vaccines that come up during the pandemic. And I just want to encourage them that your family physician is a great resource to talk to about these questions. One of the things that I've really enjoyed most over the past few years is talking to parents and patients about some questions and concerns they have about vaccines and working through some of their fears and making sure that we review the data so they feel comfortable with their vaccinations.
Age 6 months to 18 years, that's a wide range of ages. They're all eligible for the COVID-19 vaccine now, but talk about the changes and the differences in the amounts and the efficacy between the different age groups since basically everybody can get it now.
Yeah, so this is great news, Neil. This is a big change that happened last month. And so both Pfizer and Moderna were approved ages 6 months and up. And so there's a couple key differences I want to point out to parents about the vaccines. The Moderna vaccine was approved for children 6 months through 5 years old. It's 2 doses spread 4 weeks apart. The Pfizer vaccine is approved for children 6 months through 4 years old, and the older groups have already been approved. But with the Pfizer vaccine, there's a little bit of a difference from the Moderna vaccine. It's 3 doses, and so they're given the first one 3 weeks apart, and the second dose is 8 weeks after the second dose. And so it's important to remember that that third dose is not a booster. It's part of the primary series. Another thing that we want parents to remember is that if their child is 5 and up and they received their primary COVID doses greater than 5 months ago, we recommend that they get a booster.
What do you say to parents who are still questioning the safety of the COVID-19 vaccine overall, especially for kids?
So it's a great question, Neil. And so one thing that I want to remind parents who are listening is that COVID is a very unpredictable disease. And we're not sure which children will develop long-term COVID, need to be hospitalized, or even die from COVID. And so we know the vaccines are great at preventing long-term COVID, they're great at preventing hospitalizations, and they're great at preventing death. And so I think it's important for parents to think about what is the best thing that I can do to protect my children during this time. Now, in the trials of the younger children that have just been completed with both Pfizer and Moderna, they had lower side effects than even the older kids did in the trials. And we think that's because the doses that were given to the younger children were less. Another good news in those trials were there was no cases of myocarditis or inflammation in the heart in those trials. I know that was a concern with some parents. And we saw that with some older children during some of the vaccine trials and some older children earlier. One thing that I want to stress with myocarditis is the risk of myocarditis is much greater from the COVID-19 infection than it is from receiving a vaccine.
Is there anything that you'd like to add for our listeners, Doctor?
Hey, I just really want to encourage listeners out there that this is a great time to make sure that your kids are immunized. And this is a great time to make sure that your child has a well-child visit. The past 2 years, we've seen many of us get out of our routines. It's been a challenging time. Things were different, and I worry that many kids maybe didn't have their routine appointments. And so this is a great opportunity for parents listening today to say, hey, what do I need to do to ensure that my child has a successful school year when they go back to school? And one of the best ways to keep them in school, to keep them in their sports, to keep them in their activities, is to make sure they're up to date on their immunizations.
Where can our listeners go for more information online?
So there's 2 great resources I recommended. The first is reach out to your family physician. Know that your family physician knows you well. They know your medical history. They care about you. And don't be afraid to bring your questions or concerns to them. The second resource I recommend is a great resource by the American Academy of Family Physicians. It's familydoctor.org/vaccines. And you can reach it at any time if you have any questions about vaccines or need a trusted source to look at.
Doctor, it's been a pleasure. Thank you so much for your time this morning. Appreciate it.
Thank you so much, Neil, for hosting me this morning.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Chris Scuderi. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to our podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.